It's October once again, and all global health campaigns are focused on breast cancer awareness. This year, we want to put a spotlight on organizations that have been very impactful in the fight against breast cancer. We are privileged to sit with the Medical Director of Sonotech Medical and Diagnostic Center, Dr. Grace Bachman, to have this conversation to share with us her insights and the journey so far. Doctor, you're welcome.
Thank you very much for having me.
Thank you too for giving us the time and the opportunity. Tell us, what is Sonotech Medical Diagnosis Center about, and why are you big on the campaign for breast cancer awareness?
Okay, so thank you very much for the opportunity and even deciding to, create a spotlight on what we've been doing so far. Sonotech Medical and Diagnostic Center is one of the leading facilities in Ghana. It's a clinic. We operate 24 hours. And we have both the diagnostic part and then the medical part. So in terms of diagnostics, all the way from the laboratory to ultrasound to radiography, so CT scan, MRI, we go deeply into diagnostics. And Sonotech started just as a single ultrasound scan center. We started with the premise that no one should, travel very long distance before accessing some of these vital healthcare services that, are life-saving. So when we started with an ultrasound in 2012, it was at a time where, it was quite difficult to get the common service as an ultrasound scan done during the weekends, on holidays, at nights, And you know how ultrasound is vital. Like, look at pregnant women, for instance. Like, it's such a vital service that should be available, should be accessible when you need it. And so we made that promise to consistently be available 24 hours to our clients. So that's where we started from. And then right from Osun, we expanded to Atema, and then went to West Hills 1, and then now we're in Suju. So Sonotech is a full-service medical center where we have a vision of putting across full-service medical centers, not just in Ghana, but all across Africa as well. So we just started. We didn't just start. We're actually in our 12th year.
Wow.
It's been long. It feels like just yesterday when we started. So we're in our 12th year, and we're really excited about the service we've been able to provide here in Ghana for the past 12 years. When it comes to breast cancer awareness campaign, personally, when we started, initially it was just a diagnostic bit we were doing. And then I think in 2014, we made it a full clinic. One of the very first patients that we encountered, so this woman was just coming to our clinic on a regular day, maybe bring the child, probably we treat for malaria, treat for something else, they go. And at one time, we were just at our facility in Osu, and this woman was rushed in, very unconscious. So we were surprised because the whole time she's been attending our clinic, we didn't have any significant history about the fact that probably there should be anything that would cause her to be in that state. Only for us to go into her medical history and we realized apparently this woman was diagnosed with breast cancer like 5 years before that. And she started a treatment and stopped. She didn't go back again. And then all of a sudden she was rushed to us. At the time she came on, we did a brain CT scan. We were surprised at what we saw. There were metastases all the way to the brain. So now the cancer cells had left the breast, gone to several organs, and now to the brain. So that's why she came to us unconscious, and then we see this. And at that time, honestly, as a doctor, I felt like really bad. I felt this is not the first time we encountered this patient. Even if the last encounter, the encounter before the last, if probably we had gone deeper, maybe she would have told, just maybe she would have told us. But this is just one case of, several people who are diagnosed with breast cancer and just decide that, let me just stay home for one or two reasons. I don't know whether it's denial, whether it's fear, but they don't go through the treatment and they come down with several complications at the very late stages of the disease, and not much can be done. So we at Sonotech decided that we wanted to contribute significantly to the awareness campaign. So we asked ourselves, what can we do? There were a number of things that we decided to do. WHO has a global breast cancer initiative that pushes countries to diagnose breast cancer. At least about 60% of our cases that we are diagnosing here should be stages 1, stages 2. Those are the early stages of the disease. And for us to be able to achieve that, there is a need for health promotion, early detection. That's the only way we can achieve that. So we decided to go hard on health promotion. Go hard, very hard on health promotion. So for the past 10 years, all our branches across, we are constantly educating anyone who enters here, especially in October. Although we do it throughout the year, for October, you cannot enter into our facility and leave without hearing breast cancer. So you realize even on our TVs, we're playing our videos, our nurses are interacting with people, letting them know that breast cancer is real. Even if you're a mother, you come here, you have to go back and bring your spouse or your sister or even you yourself, you get screened. So that we are very heavy on the health promotion part of breast cancer. Not just people who come in, but we also partner with a lot of corporate bodies throughout the month to, educate them as well. We also use the media as a tool. There are lots of radio and TV stations that we partner with throughout the month to be able to send the information across. We believe that it's very important. Sometimes we feel we are always talking about it. Are we seeing any changes? But yes, it's working. I mean, you can't compare how we're celebrating Breast Cancer Awareness Month this time to how it was 10 years.
Yeah.
But when I'm driving to work, everyone is not in pink, but almost everyone is in pink. People are doing all sorts of things. Companies are doing stuff. People are reaching out to survivors to help them. So over the years, there's been that general awareness creation where people realize that, see, there are so many health problems, but in October, at least let's pause a little and focus on breast cancer. So for Sonotech, we've been very we've been pushing this agenda so much that health education, health promotion, that's the only way we can push for early detection. Because once people get the message, they would now see that there is a need for me to do my examinations every month. If there is a problem with my breast, I don't have to resort to herbal. I don't have to go and bath in the ocean or sea or somewhere. I don't have to apply some concoction. Sometimes when we talk about some of these things, we think it's far-fetched.
I know.
But it's amazing. In this 2025, you hear some things and you're like, it's Yaka breast cancer. I mean, we're talking about breast cancer like several years. Are you trying to tell me that you see someone with an ulcer on their breast, very, very bad ulcer, and they're applying all sorts of things. And it's so sad and heartbreaking because if breast cancer is detected early, survival is almost like 100%. If you are diagnosed at a stage 1 or a stage 0, survival is more than 90%.
Okay.
So that is what is pushing us to do what we're doing, because once we're able to get more people being diagnosed at the early stages, then survival rate gets better.
That's nice. You've covered about half of the conversation, but anyways, looking at your campaigns and projects so far, what are some of the biggest challenges you come across concerning creating these promotions?
Okay. So, along the line, when we started talking about breast cancer, I wanted people to see how real it is.
Okay.
There is a big difference if I come telling you that breast cancer is real, and then you seeing a patient who has breast cancer, and the person is telling you that breast cancer is real. I was diagnosed early and then I survived it. So at a point we wanted to, now there are so many survivors who are joining the campaign, but there was a point where we wanted to bring on survivors. But someone would tell me that, well, I want to share my story, but probably my partner doesn't want me to.
Yeah.
Maybe I'm shy of like what my church members will say.
Yes,
probably the community doesn't even know that I had breast cancer and I survived it. So it was kind of a little difficult to get people who have gone through the treatment to come share their story. Even especially, you realize that even the men, men also get breast cancer, but there are just a few of them. And the very few of them who have it, to get some of them to come join the campaign and share their story, the men, they're no. They won't come. And I think that's one of the biggest challenges.
Sure. Run us through some of the major projects you are doing in this month to help the awareness campaign.
Okay. So this year, one of the biggest things, projects we are doing with some partners is what we call Faces of Courage, Stories of Survival. This is still using our survivors as a part of the whole campaign. Sometimes we bring them on board, they share their stories, and we just let them go. But over the years, we realized that October reminds some of these people, they go through a lot. Like, you have no idea. Before October, one of them was telling me that October is coming again. October is coming. Every radio you tune to go to hear about breast cancer, mentally, they go through a lot. Trying to recall all the harsh treatments, all the, things they went through. So I realized you are not being too fair to these people. They just come in, sharing their stories. Some cry, then at the end of the day, what? So what we decided to do with the Face of Courage project was to give them like a very good one-day experience, if I should put it that way. So we had partners who would do their hair for them, who would give them nice dresses to wear, do makeup for them. You even send them Accra spa, give them a full spa day. Like a total relaxing makeover day. And now they sit, they share their stories. It was a beautiful thing. They cut cake. Someone gave them free cake. And then some of the partners also gave them huge packages. Like very, very beautiful packages. So that's what the Face of Courage project is about. Not just for us to feature these survivors in videos, but to also let them truly have a relaxing time whilst they do it. And they were really excited about it. That's
nice. We are wrapping up the conversation. Still, to add up to the voice concerning breast cancer awareness, tell the women, families, what should still be done? We are talking a lot about breast cancer. The fight is not over. It's still ongoing. So tell us something. Tell the women, tell families who are watching, what should we know and do about breast cancer?
So I think I'll conclude with the theme that the Breast Society of Ghana is using for the awareness creation. Catch it early, treat it right, survive it. The message is as simple as that. Once breast cancer is caught early and then you treat it right, you will definitely survive it. Let's make sure that if there are any changes in the breast that we pick up, the first point of call should be the hospital. And let's be breast self-aware. The advice is that for every single month, every woman, a week after your menses, do your monthly breast self-exam. The more you touch your breast, the more you know what your normal is. So if there are any changes in the breast, you'll be able to pick it up early. But if you are not checking and there are changes, you will never know. If you are more than 14 years, just pick one day in the month. It can be the first of every month. Just do it yourself. Once you are doing it consistently, you can let a medic, either a doctor, a nurse, also do it for you once a year. And then at 40 years, we advise that every woman should do a baseline mammogram. It's very important because there are some lumps or some changes that even if you do the breast self-exam or the clinical breast exam, your hand might not be able to pick it. But if you do the mammogram, if there's something very tiny in the breast, we'll be able to pick it up. So 40 years, do your baseline mammogram, and every year or 2 years, you will repeat the mammogram. If you're less than 14 years, you can do a breast ultrasound as well. And then ultimately, if there are any changes, you'll be asked to do a biopsy before the breast cancer diagnosis is confirmed. So breast cancer is not a death sentence. We can survive it if it is diagnosed early. Let's do this together.
There was one more thing. So we've talked to the women and the families. You spoke about access to let's talk to government and key stakeholders. What can they also do to improve the awareness campaign so that in some years to come, we are not hearing of any woman in Ghana dying of breast cancer?
Okay. So I think recently the government has actually started this discussion, and one of the things that came up is the Ghana Medical Trust Fund and primary health care, where any woman can actually work in any facility to say that I want to get my breast screening done and it will be free. You don't have to pay for it. And I think that would be one of the biggest breakthroughs can have, where I just walk into any government facility, I tell the doctor myself I want to get my screening done, and I'm able to go through the process without any delays. I think that's the best thing. So we need to push structures well. We need to push for infrastructure, and once people are doing their imaging and pick things up, the system should be such that it becomes easy for you to go through the process very quickly and then get all your treatment done. Because sometimes people start and stop along the way because the system frustrates them, either because it's too expensive or they have to go very far distance before even they can have access to treatment. Once government takes ownership of some of these things, and then we have facilities spread all over. Why should someone come all the way from Tamale to Accra to come and do radiotherapy because a machine up there is broken down? Why should someone go to Kumasi from the north to go and do a biopsy to diagnose breast cancer? Even the transport cost alone, how much is it? So we cannot win the fight without, of course, government seriously stepping in. Having all these services available across all the 16 regions of Ghana. If I mean, Western North is a region, right?
Yes.
If I'm in Volta or I'm in any other place, should be able to go through the treatment, diagnosis, treatment, everything from A to Z. Without even moving from my region to another region. Just because if I move from my region to another, think about all the costs, accommodation,
feeding, transport.
If I have kids, I have to send my kids to school. It has to all cost. I have to look for someone else, pay the person. So breast cancer has actually wiped away people's whole life expenditure because the cost involved is huge. Our health insurance is doing well with some of the medications and things, but we can still do better to win the fight.
Thank you so much, Dr. Grace Bakwan. This has been a very insightful campaign. And this month of October, we are speaking to all families out there, all women out there, all sick out there. Let's come together and let's win the fight against breast cancer. Thank you.